Hello guys, in this video we are going to discuss about shoulder dislocation, a topic from orthopedics. Mainly we are going to discuss about x-rays, radiology and management of shoulder dislocation, right? But apart from this, I'm also going to discuss a few important topics that are important, but these are not those things that I'm going to focus on it, right? So what is the most common type of shoulder dislocation? The most common type of shoulder dislocation is anterior more than posterior shoulder dislocation, right? In anterior shoulder dislocation, there are mainly 4 types of shoulder dislocation subtypes, right? First one is preglenoid. Second one is subcaracoid. Third one is subclavicular. Fourth one is intrathoracic. Right? What is the most common variety among all of this? It is subcaracoid. Now you can understand with the names only what are these locations, but I am not going to discuss about it because this is not my focus, right? Because questions are less asked. Test for anterior dislocation of shoulder are, there are mainly 4 types of three types of test. First one is Hamilton ruler test. Second is Dugas test. And third one is Callaway test. In Callaway test, we measure the axial circumference. Callaway test, right? I'm not going to discuss these things. Now here you can see an image of anterior dislocation of shoulder. If you see this type of photo, right? If you are going to see this type of photo, always understand this is anterior dislocation of shoulder, right? This type of photo, in this particular photo, you can see that the shoulder is dislocated, the head of the humerus is not in the proper position, and the hand or the humerus is focusing outside, right? And it is somewhat interior of the caracoid process, right? So this is a way you can understand. So we now compare it with posterior shoulder dislocation. Now the posterior shoulder dislocation is the most asked. In posterior shoulder dislocation, you can see this particular thing, right? This particular thing actually looks like a light bulb, right? It looks like a light bulb. That's why it is called light bulb sign. It is called light bulb sign, and it is seen in posterior dislocation of shoulder, right? Extremely important, light bulb sign, very important. So this is light bulb sign and it is seen in posterior dislocation of shoulder. You have to remember it, and this is the most important one that is asked in radiology, in ortho, right? They will generally not ask you anterior dislocation, they will generally give you an x-ray of posterior dislocation. Now coming to the above things, what is the management of anterior dislocation of shoulder, right? What is the management of anterior dislocation of shoulder? It is very important and very easy. They will ask you the sequence. Reduction. First of all, you will do a reduction process, right? In reduction, we use a technique which is called modified Kocher's technique. Modified Kocher's technique, right? This is the technique that is used, and in this technique, there is a sequence called TEAM, right? TEAM. TEAM is the sequence. T stands for traction, right? Very important and very easy. E stands for external rotation. Now A stands for adduction, very important, and it doesn't stands for abduction, right? It doesn't stands for abduction, extremely important, right? You have to remember it. It doesn't stands for abduction, it is adduction, not abduction. Then M stands for medial rotation. So first of all, if there is a dislocation of shoulder, you will take the arm of the patient and then pull it. They will give traction first of all, means T. Then you will externally rotate it. Then you will give adduction. Then you will adduct the arm and then medially rotate the arm lastly. And in this way, you can reduce the dislocation. And lastly, you can also put bandage, right? You can also put bandage. What is the name of the bandage? The name of the bandage is Velpio bandage. So this is a thing that you need to remember. Now coming to posterior dislocation, what is the most common posterior dislocation? The most common complication of posterior dislocation is recurrent posterior dislocation, right? And the most common lesion associated with it is Bankart lesion. I'm again telling you, I'm not going to discuss these things, and I'm just giving it for the sake of completion. And lastly, the radiology looks like this light bulb sign. So the only thing that you need to remember is Kocher's technique, Velpio bandage. In Kocher's technique, they will give you the sequence in options TEAM. And secondly, the next important thing over here in this video is light bulb sign. It looks like this. Thank you.